the Department of Public Health for Los Angeles County, Dr. Barbara Ferrer. Her bio is in your binder. If there is a California Dr. Fauci, she's it. The most quoted, and certainly the one of the most knowledgeable individuals in Los Angeles or anywhere in the United States when it comes to all things COVID. When we decided we wanted to hold this conference in LA, my very first thought was, how do we get Dr. Ferrer to come? At first, her office said no. Your conference is on a Tuesday afternoon. It's not possible. There's a supervisor's meeting on Tuesday afternoon. No way. But I learned a long time ago, if you really want something, you have to take 3 no's before you give up. So that's my rule of thumb. So I called around, sent some emails, and it turns out that one of our public health faculty members is a good friend of someone who works closely with Dr. Ferrer. Contacts, networking, it works. Soon there was an email saying she would be delighted to meet with our students. So supervisors began. Okay, so with me to question Dr. Ferrer are 2 of our sterling members of our Cal State LA Public Health Student Association. The president of our student association, Melina Rodriguez, and Samantha Zaragoza, the vice president of the Public Health Student Association. So we're going to start right out as we did with our other guests. Dr. Ferrer has seen our questions, so there's no surprise here. We're going to start with a question from Melina.
Hi, Dr. Ferrer. Great to meet you. Thank you for being with us. So our first question here today is, when did you decide to pursue public health and why?
Yeah, thank you so much. And first, I do want to thank Dr. Zelman and of course, Melina and Samantha for, just being here, inviting me. I'm really honored. I would never have said no, except for a Board of Supervisors meeting. You have to be there if you're needed to be there. So, but I'm thrilled that we were able to connect. And I want to also thank all of you. I'm so impressed you have a Public Health Students Association. My story is I didn't know anything about public health. I'm much older than all of you. At the time I was coming up, I'd never heard of public health, I'll be honest, never. And I was actually back at school trying to do some sciences because I had thought I'd wanted to be a doctor, but I was really interested in international health work. And as I was struggling through organic and physics and all the courses I decided I didn't want to take when I was in college on the first go round, a friend of mine said to me, what is it you really want to do? And when I started talking about what I felt passionate, he said, you should just go into public health, and started talking to me about what was the work of public health. And I was completely motivated at that point. I thought, what am I doing? I really, I see the work of public health as work around justice. I see it as an opportunity to really move from fixing people to fixing systems, being able to work and be closely aligned with community residents, community workers. I'm an organizer by training. That actually was, what my passion was to do community organizing and, really listen intentionally so that we could find paths and ways to get together to work to make the changes that we know result in better outcomes for everyone. It's really about making sure people have resources and opportunities to be healthy. One of that resource is absolutely access to high quality healthcare. But there are so many other things that go into our well-being, adequate housing, good paying jobs, a work environment that's free of threats. We've certainly learned that through COVID, how important safety at workplaces is. Issues related to food insecurity, issues related to making sure that people have access to transportation, that we get rid of environmental hazards that are close and polluting close to where people are living and polluting our air, our water, and our soil. That's the work that really motivated me. So I was so happy to find public health. And again, it was like many, many years ago. And feel very blessed that I've, had decades now of being able to work as a public health practitioner.
Very good. Thank you. And our second question will be asked by Samantha.
Hi there, such a pleasure to meet you. My question for you is briefly describe your responsibilities as Director of Public Health for LA County.
Yeah, it's a big question. It's a very big health department. We're the largest health department in the country, county health department in the country. We have right now over 5,000 employees, and we have a budget that's about $2 billion. A lot of the budget at the moment, close to $1 billion actually, is to help us with COVID response activities. Standard activities that you've been watching, us all do collectively for 2 years now. That includes being able to identify cases, being able to work with and interview close contacts, managing outbreaks, being able to get folks access to testing, vaccinations, and now therapeutics, a vast communication network, creating vast networks of providers to administer vaccines, tests, and therapeutics. And we're a very big county. So when you think about that, there's 10.3 million residents here, and we get probably close to another 500,000 to 1 million workers that come in every day to be in LA, and then we get tens of thousands of visitors every day. So it's a big job. We are divided into bureaus. I know you met with our health officer earlier today, Dr. Davis. Dr. Davis has broad authority and responsibility for making sure that we minimize threats to individuals' well-being. And we do that through surveillance, disease control measures, that includes TB, but there's about 35 reportable communicable diseases, and HIV, AIDS, TB. So a lot of work gets organized around preventing transmission, mitigating when transmission is happening in the Disease Control Bureau. But we also have a Health Protection Bureau that works on environmental justice issues. We have hundreds of health inspectors that go out to make sure that our restaurants are safe, our cafeterias are safe, our food trucks are safe, our pools are safe, sanitation services are safe. So vast network of folks that are really part of a regulatory system around safety. And some of that is, of course, safety at work sites as well. We do housing inspections and particularly focus, obviously, on the larger, multi-unit facilities. And then also have a health facilities inspection division that does all of the inspections for healthcare facilities. So separate unit, but hospitals, nursing homes, long-term care, specialty clinics, all are licensed and inspected on a regular basis, depending on what services they're providing. We have emergency preparedness to make sure that we're able to respond to, obviously, this emergency, but a host of other emergencies. And we have, and that's all our Health Protection Bureau. And we have a Health Promotion Bureau, which has maternal and child health services, youth services. We have services and are organized around protecting the rights of women. We do a lot of work around preventing chronic disease, again, using a systems framework. We're less about trying to change individual behavior at this point and more about trying to build up healthy communities. So the work in that bureau is central to that. We do provide services for children, particularly children who may be have disabilities, children in foster care. And I think you can, I think that gives you enough of a sense to know we do services, we are practitioners in the field, and we do policy and systems change work. So large organization with many brilliant people. So many brilliant people, lots of leadership here and lots of amazing people that are, 5,000 every day out there doing a vast array of work in service of the residents and workers in this county.
Terrific. Can you describe, the next question is for me, can you describe the decision-making process, thinking about COVID in the last couple of years?
Mhm.
Can you describe the decision-making process you use when it came to the toughest decisions you had to make? Are there group discussions, or does it sometimes come down to you having to make a call? Maybe with insufficient data.
Yeah, I think it's a really important question. I mean, obviously, I'm the director, and at the end of the day, when we don't reach consensus, I'll go ahead and make that final decision. But we have a policy group and a leadership team, and I've never really moved without consulting members of that team. That team has epidemiologists, clinicians, infectious disease docs, all who, we meet, obviously in the height of the pandemic, 7 days a week we were meeting. Now we're down to about 3 meetings a week on average. If we need more, we have more. And we really try to come to consensus about the big decisions that are going to drive the actions, both the actions of the health officer and the actions of our entire department. And we also spend a fair amount of time discussing how we're going to communicate those decisions. I will say that this has been, I think, the most challenging decision-making situation that we've ever been in, because we are operating, as much as we like to be science-driven, we are operating with a lot of uncertainty from the very beginning. And that's cost us. And when I say it's cost us, it's cost lives, that uncertainty. We spent months not recognizing that there was a lot of asymptomatic spread that led to decisions about people not needing to mask at the beginning of the pandemic. We had no testing capacity. Even though we have a public health lab, we couldn't get reagents. So ill prepared to be able to, knowing you have a fair number of asymptomatic people, distinguish between those people who were infected and not infected. And the science kept changing as we learned more and more information. We had to somehow be comfortable enough knowing that we were going to need to change decisions, and everyone hated that. And that's just human nature. People wanted a lot of predictability when we couldn't offer that. But I don't think there's been a single decision that hasn't been, explored deeply by our leadership team here in our policy group. There have been some times we haven't come to consensus, and I've moved in one direction, but I have benefited every single day from the brilliance of the wise counsel of this leadership team at the health department.
All right, thank you for that insight into how the difficult decisions are made. I want to ask you a somewhat more personal question, but probably and hopefully you will never experience anything like the last couple of years in your career. But much as we all want it to be over, do you think you'll miss any of it? The daily challenges of facing difficult decisions, the opportunity to educate people about public health, even the spotlight you're in. Do you think you might miss any of it?
I don't think so. I mean, two years ago, nobody knew who I was, except for the people I was working with, and I was fine with that. I mean, I don't think people go into public health because they're looking for a highly visible public speaking role. Like that's not our nature. That's not what's driving us. I mean, I feel like we do our best work when we work collectively with others. We do our best work when there's collective leadership, when lots of different people can in fact come together, work together, and take on different sets of responsibilities. So this has been, I think, a challenge, not just for me, but I think our whole leadership team, and I think public health, leaders across the country. In many ways, we're rooted in sort of a spirit of collectivity. And as you all have witnessed, during an emergency, that can get frayed at the edges. there was also, a fair amount of issues around security, personal security, security of the workers here. And we had to make some strategic decisions about how many people were going to be public facing, because there was a fair amount of, as you all know, animosity and, I think, in some ways, very, hatred directed against public health figures. And I'm not going to miss any of that.
Okay.
I have loved being able to work with so many amazing people in our communities. I mean, we have built out our partnerships extensively with businesses, with other healthcare providers, with community-based organizations, with faith-based organizations. I have met hundreds and hundreds of residents and workers. I usually am at one of our vaccination sites every week for a few hours or a day. And I have seen, the most generosity and kindness I've ever witnessed in my life. So I feel like it has not, I would never want to paint a picture that this has been like an absolutely horrific 2 years. I've learned a lot, and I've, just as I noted, I've met these amazing, amazing people all across the county. But I will be very glad when we get to a different place in this pandemic, and we can, most importantly, go back to doing some of the very important work we were doing before the pandemic on big issues that, need our collective action. Infant mortality among Black residents, Black babies, infant mortality amongst Black women. I want to get back to doing much more environmental justice work. So, it's been hard to balance all of the work that we would like to do with the overriding needs of getting through the pandemic. So I don't know how much I'm going to miss of some of the things you
Right.
mentioned.
Point made. Okay, our next question is going to be asked by Melina.
So you've been reflecting back on COVID-19, and we wanted to know, what were the difficult decisions that you had to make, and why were they so difficult?
I think the most difficult decisions we had to make were decisions that we knew were affecting the economic vitality and the livelihoods of so many people. I think it was hard, and it was heartbreaking. I mean, we knew that. We knew when, at the beginning, we just didn't know enough, and we didn't have enough tools to prevent a lot of spread, that, we were closing down lots of places that weren't, deemed essential, but they were essential places for workers to get a paycheck, and for business owners to get a return on their investments. And it was really, really hard to make those decisions. But I will say it's equally hard to make decisions on removing some of the safety protections, when I know, and that based on the data, we have a lot of vulnerable people, most likely or more likely to be Black and brown people, to be people who live with few resources, our lower wage workers who are at higher risk and have benefited from some of the safety protections, particularly those at workplaces. So, I will say, all those decisions that, at the end of the day affect people's lives and their livelihoods are really, really hard decisions to make. And when that there's going to be a vocal, often minority group of folks who are going to really hate those decisions and, challenge those decisions, it makes it hard not to get swayed by sort of that public sentiment that's loudly expressed, and instead continue to go with the science. So I will say, the decision making has been challenging. There's not a day that goes by, I don't think, for any of us here, where we're not aware that in the last 2 years, 32,000 people in LA County died from COVID. That's, hundreds of thousands of people who have had their lives upended because their friends, families, and coworkers of people who lost their lives. We have tons of people who are dealing with long COVID. We've had, children sadly pass away, and children with MIS-C as a consequence of having a mild case of COVID have ended up with a very debilitating disease. So, we're aware of the tragedies around people's lives and their livelihoods, and it weighs on us. Those are decisions that I think weigh on us.
Very good. Thank you. Tough answer. Tough question. If you were retired and your successor
Amazing.
and your successor called you up and said there was a new virus spreading quickly in Europe that might be as dangerous as COVID-19, and she wanted your advice, what would you tell her?
So sorry. It's a great question. I mean, I would tell her that she needs to make sure she pulls together an amazing team of partners. Like, the first thing you really are going to need to do to get through any, sort of threats from future viruses is you're going to have to recognize that you need a lot of partners to do this work. And, I guess my advice would be, don't wait until you've got the new virus circulating somewhere else in the world to recognize you cannot do this work alone as a public health department. You have to have those partnerships. And the more you secure those partners by being a good partner yourself, like that means we have to sort of change how we do business, the better off you're going to be at the start of any new viral threat to the collective well-being. I would say the second thing I would say is, and these are all things, I would do ahead of time, kind of is, you need a good communications team. So much of what we have to do is about communicating to each other. So we need good internal communication strategies and systems, and communicating with others outside of our department. And communicating is not a one-way street. It's not like we give you information and then we've done our job. Communications is really about an exchange of information. So getting and giving. We weren't prepared for that. So I would make sure that, the next person coming in that would have that responsibility would have worked hard on having that team in place. But if it's not in place, those are things that you really cannot do this job without having a good network of partners and a system in place for working with those partners, and an amazing communication team that really understands the complexity of the information that we're going to be both gathering and disseminating.
With that in mind, we have a perfect next question to be asked by Sam.
Okay, my question is, what do you think can be done to better explain public health to Americans?
It's a great question because, before this, nobody knew us. And, I think the few people who did know our work knew it because we are a direct service provider. So I think lots of folks may have understood the services we provide at our clinics. We do vaccinations, we do TB, we treat patients with TB. We do a lot of testing. We have robust efforts around sexual health. I don't think so many people knew that the environmental health inspectors that you see in the restaurants, the grades that you see at each building, an A, B, C, hopefully nothing lower, for the restaurants is a public health task. I don't know. I think some people know us because we always do follow up on communicable diseases, but I don't think a lot of people knew of all of our efforts to work with our community partners to eliminate the gaps in infant mortality or the gaps in Black maternal mortality. I don't know that people recognized the work that we do to make sure that we're addressing environmental injustices and that we're building community, that we're working with others to build communities where people have the resources and opportunities they're going to need to be healthy. And the only way I know at this point to better explain what public health does is to become a trusted partner with everyone else. I don't think you can, it doesn't matter how many times you do a media briefing or you do a telebriefing with your sector representatives. The most important thing that would help people better understand what we do is if we were really good partners in the communities. If people knew who we were, put a face to this work, saw us as really their support for building good health. Understood that, relationships with the medical system are important, but that public health is offering something else. But the only way I think that happens is if we're actually in our communities providing a different set of, offering a different set of activities that really supports what it is that residents and workers identify they need for their health and well-being.
So in a sense, actions speak louder than words, as they say.
Yes. I mean, if you think about the tragedy of the last 2 years, is that people believe an anonymous YouTube video over Dr. Davis or, myself or Dr. Balter or Dr. Simon. We have no credibility with so many people is damning, but it's damning for us. Like, we haven't done our work, and we need to understand that a history of distrust follows us. So there have been very good reasons by past actions that people don't trust government, particularly people who face a lot of racism and discrimination. And that doesn't just go away because you're in the middle of a pandemic. It doesn't, you don't become credible because I feel like I'm a good person. That's not going to work. That credibility is built over time, and we have to do the hard work of building those personal relationships now.
Thank you. Our next question is going to be asked by Melina.
So on a personal level, how do you deal with all of these enormous pressures and responsibilities that you deal with in your current position? And do you have any tools that enable you to relax and get some relief from those pressures?
I think it's an important question. And, I would venture to say that y'all had enormous pressures these last 2 years as well. I don't know a single person who's gone through the last 2 years that hasn't had a lot of pressure and a lot of new responsibilities. I just don't. And, sometimes, folks will see the, sort of the leadership team as, having like these enormous pressures, and individual people, all of you, our students, our faculty, our staff, as, not having nowhere near the pressure. But I actually don't think that's true. First of all, I'm surrounded by an amazing team. And as I've noted, we've had amazing partners. Second of all, I think what's been scary about the last 2 years has been scary for each one of us. The uncertainty, the high rates of morbidity and mortality, the constant worry about both protecting ourselves, but protecting others, sort of the inability to be in full control over our destinies, I think has affected every single one of us. And I think we've all had to grapple with how do we get some relief from all of that stress, from all of that anxiety, from that fear. And I'm like all of you, I had to find some strategies for that. I mean, I'm very physically active. The hours were really rough. So, I had to really, and at the very beginning, I just stopped being so physically active. And then a few months into this, I realized, I'm not going to get through this if I don't, go back to having an exercise routine. And so I just added that back in, and made a huge difference. I also, and my team knows, I have a pretty hard rule. I work a lot of hours every single day. But, sometime between 9 and 10, I tune off, I shut off. I shut off, people know if there's an emergency, obviously people know how to reach me. But I stopped looking at my emails, and I stopped trying to do work, and I try to read a book, watch TV, do something that allows me to get my mind off of the problems and the challenges and the opportunities that we're grappling with, and just get ready to try to get some sleep so that I'm not taking all of that to bed with me. And those are things that have worked for me. But I want to note, like, you all had to find things that worked for you. And it's not the same thing for any of us at all. And I also want to note that throughout these 2 years, for many people, they've needed to seek additional support. And I know that Cal State offers a lot of that support. And I want to say, you know, we've offered it to all of our workers as well. We introduce things like everybody gets a guaranteed half-hour off every single day to take care of themselves, whatever, you know, during your workday, because we know how much stress this is. And, you know, so I hope you've had resources at Cal State. I hope you found resources in your personal life. And I just close by saying the last thing is I have an amazing support system. And I know everyone's not as blessed as I am with that, but I strongly recommend, as part of your professional growth, you find that support system. You find those people who really care about you and are going to help you when things are not going well, because we're all going to have those times where things are not going to go well.
And probably we have to find ways that we can help them in the same way.
Yes.
that they're away from.
Yes, I think that's a great point. We can help each other also.
Our next question, I think I could write your answer to, but because you've revealed it in a number of ways already, but I'm asking Melina to ask it anyway. It's an important question.
So what are some of the greatest rewards, and it's a two-part question, and some of the greatest challenges in pursuing a career in public health?
Well, I think, you know, obviously I've been in public health for decades, so I obviously love it. And I know for me, I love it because it allows me to work with others around the issues I care most about, which is justice, fighting racism, fighting economic deprivation, being able to make sure that we're constantly addressing issues of marginalization, and that we're frankly building the world that we want to live in, and we want our children and our grandchildren to live in. Because it's a world where people treat each other with respect and they actually have the resources that they need to be well. And I can't really, there aren't a lot of places you get to go and get paid to do justice work. Yeah, I mean, you could be an organizer. I think you can work in education. I think you can work in public health. You know, and probably there are other service-oriented organizations that also, you know, are really in it to make systems change. But that's what I love about this work, is you actually can not, you know, focus solely on, you know, finding out what's wrong with a person, why they're not well, and trying to fix that person, help that person get the care that they need. You get to actually look at all of the systems that make it easier or harder for people to have what they need to be healthy. And I love that work. And, you know, I think if you love that work, public health will be an awesome place to be.
Right.
But I do think it's challenging. I mean, I would, you know, obviously the last 2 years have been extraordinarily challenging for everyone, and certainly for people in public health. That there's been a lot of challenge. I would say, you know, the two biggest challenges are that we're woefully underfunded for what we need to do. And I would say the second challenge is that the training opportunities so that people can build the skill set that's going to be needed, I think, for the future aren't always easy to find. So I think you're gonna need to sort of build out your ability to find places where you can go to get the training. I mean, I often talk like we got people who are really good at communications, and then we got EPIs. But really in public health, you need EPIs that are really trained as communicators, or you need communicators that have a good background in EPIs. So, and we don't necessarily have that in one place. So people are gonna have to like go ahead and identify the skills that they're gonna need to do the job as best that they can, knowing that the systems around us aren't necessarily keeping up with where public health is gonna be in the future.
I think your answer leads to our next question, which will be asked by Samantha.
All right, so what advice would you give to students like us considering a career in public health? For one thing, will they need a master's or a graduate degree to be eligible for leadership positions or just have a position with responsibility?
Well, it's a great question. It's a difficult question for me because I'm a big believer in like your experiences really, really matter. So what you've done for work, has built a skill set that, frankly, you don't often get in the classroom. So I want to just really appreciate that, your experiences working, volunteering, taking on responsibility for community activism, all count a lot in public health. And you should never downplay that side of who you are. But it is getting increasingly more difficult to move into positions of leadership without having a master's degree and some training, some advanced training. But I want to note that it's not often a requirement. It's just, it's a very competitive world for some of the work. And folks that come in with that additional training that you can get with a master's program often have some advantages. So I think the issue is not all master's programs are equal. You should make sure that if you're going to invest in an advanced degree, you're investing in an advanced degree that's really going to build your tools and not just give you sort of that diploma. I know that there are places, where it's easier to get a master's degrees than others. And, for some folks that might work well, but I will say, don't spend the money or the time on a master's program if you're not actually going to build your skills. Like a master's programs are great if you're really building your skills. I loved my master's in public health program. I loved it. I've also, as you know, I have a PhD, but I felt like my master's program is where I built my skills in public health. I learned so much in that master's program. And I went to a great program where they really offered what I was looking for, which was an opportunity to actually build actionable skills. There was plenty of opportunity for internships. There was plenty of opportunity to do casework, it was real. And that's not the same for everybody. It really depends on what you want to do in public health, what you're going to need. But I will say for the more senior leadership positions, I think everyone on our team probably has a master's degree.
My next question is, and you mentioned this earlier, before the pandemic, you were very interested. I first met you at a USC meeting several years ago. I can't remember what the occasion was, but it was in a basement in the library in USC someplace. And you talked a great deal about structural racism and inequities. This was before COVID, and how we had to change the socioeconomic circumstances and all of this in order to deal with get to some of the roots of public health. And you were involved in those issues and you wanted to look at them, and obviously some things got in the way. But how do you feel that the epidemic has affected those kinds of things or made people understand those kinds of things more? And do you look forward to maybe when this is over getting back to a focus on some of those things?
Yeah. For me, the horror of the pandemic is that it has magnified what we knew was true decades ago, and we should have resolved decades ago. I don't know how many people know the reality of what's been happening, but it's not just that Black and Brown and people living in communities with high rates of poverty are doing so much worse. It's not just that they have a lot more cases, that they have higher rates of hospitalization, and most tragically, they're dying at higher rates. It's that even when fully vaccinated, Black, brown, and people living in poor communities do worse than white and Asian residents, especially, it's especially glaring around poverty and residents living in the wealthiest communities. Vaccinations is not an equalizer. So we put a lot of effort into making sure that everyone has easy access to vaccines. We try to make sure they also have really easy access to good information, places to go get their questions answered. But the data doesn't lie. Like, if that's all you do, you are still going to have a much greater toll experienced by people of color and by people who live in communities with high rates of poverty. And that's because the root issues for the very same issue that's we've seen for decades now around other chronic illnesses, around diabetes, mortality, around infant mortality. Black babies in this day and age in LA County are 2 to 3 times more likely to die than white babies. How is that possible? How is it possible that Black women die at 4 times the rate of other women from complications due to pregnancy? And you have to, you sort of have to peel back that onion, and you have to sort of say, like, this is not about getting people medical care. That's part of it. That is definitely part of it. If we don't have good access to vaccines, the problem gets bigger, but it's not sufficient to just tackle the problem by providing a service. Because at the heart of all of this is work to dismantle racism, work to dismantle those systems that give some people privilege based on the color of their skin and marginalize others. Work on the issues related to economic disadvantage. Nobody should have 3 times the death rate because they live in a community that has high rates of poverty when compared to people who are living in the wealthiest communities. There's no way it makes sense that people fully vaccinated who are poor have worse, are more likely to be hospitalized, 2 times more likely to be hospitalized, I think maybe even 3 times more likely to be hospitalized than very wealthy people who haven't even been vaccinated, unless you start looking at what's going on here. People who have less income, people who have a lot of discrimination about their job opportunities are much more likely to work in places where they had a lot more exposures and continue to have a lot more exposures. They didn't ever get to go home and telework. Okay, never. They're in our factories. They work on our transportation system. They're in the grocery stores. They're in the pharmacies. They're working in healthcare. There are custodians. They did not go home, and they still don't get to go home. And they have a lot more exposures. And then they live in communities that have high density and in housing that's substandard. And they may, because they're not paid a livable wage, they may have issues around overcrowding. So very easy spread from the work site goes right back into the community when they go home, and then back into their homes. And that's the cycle that we're in. Lots of people, the reason why we have such high rates of hospitalization amongst people of color and poor people is they also have higher rates of all of these chronic diseases because of the very same root causes. Not because they don't want to eat healthy, not because they don't want to exercise, not because they don't want to take care of themselves. Because they can't afford expensive organic foods. They can't afford they're working 2 jobs, and they live in a neighborhood that doesn't have a lot of green space and doesn't have safe space. They live next to an oil drilling facility. They live in the community surrounding the Exide plant, and they have high levels of lead. This is why things are so bad. And until we want to work together to address those causes, we're going to continue to see what we just saw, which is heartbreaking and frankly immoral.
I have to ask you, does this mean we have to change not just our policies or our socioeconomic system in some ways, but that we have to change our values? Can we get to address these problems without a change in values?
Yeah, I think you have to do both. I would never delay systems change work while we try to get everybody to embrace a new set of values. So I would always encourage us to incremental change is not bad if it's substantive. So, and it takes a long time for people to change their values, and people have to go on a personal journey, and we can't wait for everyone to do that personal journey work before we make some of these changes. I think you have to do both.
Okay. I want to thank you for your time, but we have one last question. It's
Okay.
for you, really. Is that we've asked you everything in the world that there is to ask about public health, but is there something we left out? Is there something you would want to tell us that we haven't asked you?
I think the most important, sort of issue for all of us is to find meaningful work and to be in a place where not only do you feel passionate about the work, but you're well respected, and you have opportunities for growth. And I also loved what you said earlier about that correlates with opportunities to do good and to give back and take care of each other. I mean, I think fundamentally we, find our place in this world when we're in those relationships that have meaning, because we are able to both be compassionate and respectful to others, and we feel that others are being compassionate, respectful to us. But what I want to say is that's not a passive activity. You get to build that future. You get to build that workplace. You get to build that family. If you walk into something and it doesn't have everything you're looking for, then the challenge is to be part of the opportunity to sort of shape those experiences that you're having in ways that actually allow you to build in the things that I think are, for all of us, essential to our emotional well-being and, frankly, our physical well-being as well.
Dr. Ferrer, thank you so much for spending this much time with us.
No, thank you all. Thank you all for hanging in for 2 years. So, and I'm thrilled that you're even considering, coming into public health. I want to let you know we have a lot of jobs that are going to be opening up. So
great.
This
We
is
have a lot of people to fill them.
field. Yes, this is a good field to be going into right now.
Great. And we have a lot of internships at LA County that we actually, we do. We have, I think our internship coordinator is in here somewhere. Sorry, but we do a lot of internships where we try to work with the county on various different projects and all kinds of things. I also want to thank Melina and Samantha for helping out and asking our questions.
Yes.
Okay.
Thank you. It's wonderful to meet all of you. And I look forward next time being in person. So thank you.
Terrific. All right. Thank you. Good night. Okay. You might have thought,